Okay, everybody. Well, thanks so much for being here. I'm Mike Gonzalez. I'm the Senior Public Affairs Manager with Franklin PUD. This evening's event couldn't have happened without the collaboration of the Benton-Franklin Health District, City of Pasco, the individuals who will speak this evening, and our community stakeholders, so really appreciate it. And excuse my Spanish, es más o menos. Gracias por estar aquí. Soy Miguel Gonzalez, gerente de Relaciones Públicas de Franklin PUD. El evento de esta noche no podría haber ocurrido sin la colaboración de Benton-Franklin Health District, Ciudad de Pasco, las personas que hablaron esta noche y los participantes de nuestra comunidad. So thank you everybody that made it out here tonight. And also thank you to the media who have really done a good job during this pandemic getting the word out. I've been there, done that, so really have a lot of respect for what you guys are doing every single day out on the front lines. Speaking today are really some special guests that I really appreciate them all coming out. Dr. Amy Person from the Benton-Franklin Health District, Angeles Eyes, who's an epidemiologist with the Benton-Franklin Health District, Dr. Raul Garcia, who's an ER doctor with Lourdes, Ophelia Brett from the Hispanic Chamber, Frank Valle from the Latin Business Association, Gabriel Portugal from DPDA, Alex Ybarra, who's a state representative, and also our very distinguished mayor, Saul Martinez. So if you guys can give them all a round of applause for being here, we really appreciate it. We are going to start with Alex Ybarra, who is a state representative from the 13th District. He's got to head back to an event up in Quincy, so we're going to have him say a few words, and then he's going to boogie out of here real quickly. Thank you, Alex.
About 3 minutes? 4 or 5 minutes? Okay. Well, muchas gracias a todos. Me llamo Alejandro Ybarra y yo soy de Quincy, Washington. My name is Alex Ybarra. I'm from Quincy, Washington. I'm state representative from the 13th District, which is Grand County, Lincoln County, Kittitas County, and North Yakima. So I have a lot of Central Washington here. So I'll keep it nice and short and sweet. I've got a story about what happened in Quincy about the COVID. So I'm in Olympia as a state representative, and I'm there in March when COVID hits. And when I got home, well, first off, I got news that Quincy had the first death of COVID in all of Eastern Washington. So at that time, we weren't really sure what was going on, what was happening, but it really scared our town. And next thing you know, within a days, we had 20 cases. And that was before anything was happening. That's when Seattle started taking off. We took off at the same time. And in 2 weeks from the time I got home, we had 45 cases. We only have 7,000 people in our whole town. And that was in 2.5 weeks. So it really scared the heck out of the whole town. So what the town did is it got together, the city mayor, the chamber, the Hispanic community, the priests, just everybody got together, and we tried to figure out what to do. And it was like, what do we do? What do we have to do? And so the first thing was grocery stores were open, but they had their own requirements that they had to fulfill. So what we did as a group, 10 of us, we started cleaning the carts that come in and out of the stores. People were touching them, and we figured out that was the first thing we could do, which was fine. And again, and I'm going to take it right back to the Hispanic communities, the Mexicanos that work in town, right? So next thing you know, these people are cleaning the carts, and I start getting emails because I'm a state representative, and they say, Alex, all these Mexicans are in the stores. And you remember, this is Quincy, Washington. There's only 2 grocery stores. They said, all these Mexicans are in the stores. They have no masks. They're touching fruit. They're touching everything. They're not social distancing. Can you help? And I didn't know how to help. So the group got together and we said, what is the problem? We've got the signs up for all these people. We've told everybody mask up. We said everybody stay 6 feet apart. What's going on? Why are they not following the rules? Well, one of our pastors, who's a Mexicano, he comes and talks to the Caucasian group, which is most of the folks, and he kind of said, you know, these guys come from a different country. So when you guys say don't touch fruit, that's what they do over there. They touch their fruit, they grab it just like anybody else, checking a watermelon, see if it's ripe and stuff. That's what they do. And another thing was these guys are farm workers. So we've got a lot of H-2A workers. And does everybody know what an H-2A worker is? And if you don't, what an H-2A worker is we get farm labor. Since there's not enough migrant workers in town, we fly them in, and they stay at the farms with the farmers. So we have trailers for these guys. So the next thing that was happening is that the farmers, because these H-2A workers are at the farms, they had to get shipped in by bus to the grocery stores, 2 of them, plus the 2 or 3 banks in town. So next thing you know, we got a lot of farmers in Quincy, so we had 700-800 Mexicanos running around with no masks and no instructions on what to do. So the priest kind of told us, look, you guys, these guys from a different culture, they don't understand. And we said, but we've got signs up, even in Spanish. And they said, you guys, they're farm workers. So most likely they're not literate in English or in Spanish. So they can't even read the signs. So why don't we do something about that? Why don't we tell them about social distancing? And so then the farmers and orcharders came in and they said, hey, we've already trained these guys. The health department told us what to do. The health department gave us instructions. We gave it to the foreman. He talked to the guys, and they all know the rules. And then we said, well, they're not following it, so what are we doing? So then that was the culture part. The culture part was, all of a sudden we said, okay, these guys don't get it, because these are young guys, and everybody's saying mask up, and they're going, mask up for what? What are you talking, what's COVID? Because they're sitting on the farms, they don't have CNN on, or Fox News to tell them what all this stuff is. They don't know. So what happened, my sister worked for a migrant clinic, and she went out to every farm and every farmer, and she went out there, and she's Hispanic, speaks the language, knows the culture, and explained to the guys the rules again from the health district. So you did it twice. And then when she went out there and talked to these guys, all of a sudden they got it. All of a sudden we went from 20 cases to 45 in 2 weeks to 56 in a month and a half, which we only increased by 10 when we were going crazy. And so that's what really happened. And at the same time, our group got together with all the orchards and farmers and said, you guys can't come in on Thursday nights after work when you pay these guys. You have to go from Monday, Tuesday, Wednesday, and we're going to just section you off so we don't have 600 guys all at one time. So when that happened, our coronaviruses went down. And you could see when all that happened, they were all masked up. Every one of them was masked up. So everything was good, everything's going great, but then all of a sudden, we goes to phase 2. Phase 2, what happens at phase 2? Well, everybody relaxes, forget the masks, so that's where we're at now. We've got numbers are jumping again. And so the reason I'm here is to make sure that everybody here understands masks work. I'm not a doctor. There's probably some doctors here who could tell you how it works, but it's not me. I can just tell you from experience that without the masks, my numbers are jumping. And then we're going to go back to phase 1, and we don't want that. You guys are here at phase 1, and it's much better at phase 2, let me tell you. So again, everybody mask up. That's what we need to do. True story that happened in my town. It can happen here, and you guys can make it happen. And people in this that are standing here can all make it happen. Just give it a shot, give it a try, talk to the folks, make sure you know where they came from, make sure you explain it in their language and in their culture so they get it. Because not everybody does. Even Americans that live here or born here don't get it. So when it comes to farm workers, when it comes to Mexicanos from a different culture, make sure you explain it, and you explain it well, and you follow the rules. And mask up, please. Muchas gracias.
Alex, thanks a lot. Can we give him another round of applause for coming all the way from Quincy? I mean, and Alex made a good point about masking up, and a point that I wanted to make in this event is, we came together with the focus on the Hispanic community and the effects that COVID is having, but we also want to make it really clear that we're not pointing any fingers, we're not laying blame on anyone for the virus's spread, or we're not even telling you to wear a mask, but we're not saying that the mask is the cure, but we know that masks help prevent the spread, and we know that it helps you protect others. So again, we know this has become a political thing. It's become a divide in our country. It's even become a divide here in the Tri-Cities, but we want to take politics out of it. We want to take race out of it. No one is to blame here, but we need to do everything that we can to try to get to that next phase. So with that being said, I want to introduce Dr. Amy Person with the Benton-Franklin Health District.
Thank you. As you said, I'm Dr. Amy Person with the Health District. Me llamo Dr. Amy Person. My Spanish is not very good, so Angeles Assis is going to follow me and make my same statement in Spanish so that we can share it with our whole audience. So first, I do want to thank all of the workers that have been out there every day, keeping us healthy, keeping us fed, keeping us safe. Wearing a mask is not just part of the uniform that you wear at work and then take off when you get home. It's something that we wear to help protect our families and to protect our communities. Wearing a mask can reduce the risk of spreading droplets, which are one of the ways that COVID-19 can be transmitted from person to person. Even when we feel healthy, we may still be infected, which means that we can still pass the infection to others, particularly when we're not able to stay 6 feet away from one another, physically distanced. So you may be sick and transmitting the virus and not even know it. If you are having symptoms or if you think you have been exposed, we do encourage you to get tested. There is free community testing now available in Benton and Franklin counties for anyone who feels they need to be tested. They just need to call 211 to schedule an appointment. We know the Latinx community has been hit hard by COVID-19. Many of them are essential workers who have not had the luxury of being able to work from home. Benton-Franklin Health District is really asking for your help so that we can serve you and our community better. We're also asking for everyone's pledge to wear their mask. Wear it. I wear my mask to protect and honor my mother, and so we're asking everyone to wear their mask to honor their grandparents, their brothers, their sisters, their children. Thank you.
Muy buenas tardes a todos. Mi nombre es Ángeles Cise, soy una epidemióloga del Departamento de Salud de los condados de Benton y Franklin. Antes que nada, quisiera comenzar con agradecer a todos los trabajadores de nuestra comunidad que de una manera u otra están aportando, ya sea con provisión de comida o cualquier otra forma, manteniendo nuestra comunidad sana. Quiero que sepan que su trabajo es bastante importante y lo valoramos bastante. Para comenzar, quisiera dejarles saber que el uso de cubrebocas no es simplemente porque es parte de nuestro uniforme de trabajo de todos los días. El cubrebocas tiene que ser usado para que podamos proteger a nuestra familia y a nuestra comunidad de lo que es la enfermedad de COVID-19 que ahorita estamos pasando. Entonces, el cubrebocas nos ayuda a prevenir la transmisión de lo que son gotas o secreciones, las cuales pueden transmitir este virus. Lo conocemos como COVID, pero también se conoce como el coronavirus. Y es muy importante que sepamos que el cubrebocas nos protege especialmente cuando no podemos mantener esa distancia sana de 6 pies o más entre las personas que están alrededor nuestro. Así que es por eso que es importante que lo usemos. Aun cuando no nos sentimos que tenemos síntomas o nos sentimos que estamos bien fuertes y saludables, aún en esos momentos podemos transmitir esta enfermedad y podemos transmitir a aquellos sin saber que lo estamos haciendo. Si usted está enfermo o usted ha tenido contacto con alguna persona que ha contraído esta enfermedad, es importante que se haga la prueba. Queremos que sepan que la comunidad tiene pruebas disponibles que son completamente gratis para todas aquellas personas que necesiten hacerse la prueba, que tengan síntomas o que hayan estado en contacto con alguna persona que sí fue positiva para este virus. Lo único que tienen que hacer es marcar el 211 para que puedan hacer su cita para esta prueba. Es importante que sepamos que la comunidad latina está siendo fuertemente afectada por el COVID-19 y es por eso que el Departamento de Salud está tratando de hacer lo mejor posible y estamos pidiendo su ayuda para que podamos asistirle en la mejor manera que podamos. Le estamos pidiendo a cada uno de ustedes que son parte de nuestra comunidad de que hoy se comprometan a usar un cubrebocas, mascarilla, como usted le quiera llamar, para que usted pueda proteger a toda la comunidad. Le pedimos que la use en honor y en respeto a sus abuelos, a sus papás, a sus hermanos, hermanas y a sus hijos. Esto es importante que lo hagamos para proteger a nuestra familia de lo que es el COVID-19. Muchísimas gracias.
Angelise, thank you so much. Can we give her another round of applause? Because they really have been on the front lines. Our next guest speaker is Dr. Raul Garcia. He is really at the front lines in Yakima and here in the Tri-Cities. He runs the ER department here in Pasco at Lourdes Hospital. He's also running for governor, and he wanted to give his perspective on the pandemic. And Raul, thanks for coming. We really appreciate it with such a busy schedule.
Good afternoon. Buenas tardes. We have seen an unprecedented event, and hopefully I am here to educate the public so panic and fear doesn't set in. Panic and fear lead to stress. And stress leads to lowering our immune system, which is counterintuitive of what we're trying to do. We beat this virus by having a great immune system, by protecting ourselves to be healthy and getting over this pandemic that is out. We don't quarantine to eradicate this virus. This virus is out everywhere, and what we can do is help the healthcare personnel treat all the new infections that we see so we can succeed. A mi familia hispana, les digo que lo que pienso que tenemos que hacer es educar a todo el mundo para que ustedes mismos se sienten ahí y puedan decir lo mismo que yo les dije a ustedes, a su familia y a los queridos. Esta pandemia ha causado mucho pánico, mucho miedo. Y el miedo y el pánico bajan el sistema inmunológico que tenemos nosotros. Eso es lo que estamos tratando de no hacer. Estamos tratando de mantenernos fuertes para combatir este virus. So we have a higher amount of infections, but we do have lower hospitalizations and lower death rate. We have to be proud of what we've done. And the infections are out there, so now we have to help our healthcare personnel make sure that we bring it to its knees and we beat it. I've seen a lot of panic and fear, but I've also seen a lot of courage, and I've seen a lot of selfless acts, and that's what I ask from everyone. I will tell you why I wear a mask. I may have been exposed to many things in the hospital. So when I cannot socially distance, I wear it for you, not for me, to prevent my saliva from coming out and hitting you in a cough or as I speak. The other reason I wear it is because if you feel safer that I wear the mask, it's not a big deal for me. I do defend our rights to make our own decisions. And I will never mandate that, but I will educate you to tell you what the benefits are of it. Les digo por qué yo me pongo la mascarilla. Me pongo la mascarilla porque yo he podido estar en un lugar que haya tenido enfermedades que estén viviendo en mí y no saberlo. Y me pongo la mascarilla por ustedes, por proteger a otras personas de que mi saliva no salte y llegue a donde está usted. También me pongo la mascarilla porque si usted se siente bien y más seguro que yo tenga la mascarilla puesta, no es una cosa tan grande para mí ponérmela. Pero sí defiendo el derecho que usted tiene a tener su propia responsabilidad y hacer sus propias decisiones. Entonces mi trabajo es educarlo a usted para que haga esas decisiones. We live in a beautiful place here in Eastern Washington that has great weather. This virus is still not airborne. I want to be very clear. So we can beat this pandemic if we are responsible and if we are educated the correct way. That's what I came here to do. I hope that what I said makes sense and is clear so you can make your own decisions. And seriously, you and I and all of us here could work together to beat this virus and continue our normal life. Vivimos en un gran lugar aquí, un lugar que tiene un clima muy bonito. Este virus todavía no está en los lugares afuera, en el aire. Así que vamos a concentrarnos en ser más saludables, en comer bien, en dormir bien y hacer las cosas que nos hacen fuertes para combatir este virus. Vamos a proteger a esas personas vulnerables, esas personas que tienen enfermedades del pulmón, del corazón, que son más viejitas y que tienen diabetes. Yo creo que unidos podemos tomar decisiones para terminar esta pandemia. Y lo vamos a hacer. Vamos a estar orgullosos de lo que hemos hecho. Muchas gracias por su tiempo. Thank you very much for your time. Let's do this. Let's beat this pandemic right. We have what it takes. Thank you.
Thank you, Dr. Garcia. Can we give him one more round of applause for those words? Thank you. We really appreciate it. We're going to switch gears away from our health professionals to some of our business leaders right now that are really being affected quite heavily by COVID-19. You look around these shops here in downtown Pasco. They haven't been able to open for 3-4 months. You know, they've been talking to us in various capacities with the PUD. And it's heartbreaking when you hear the stories of not being able to pay power bills and you know, just wanting to open. So with that being said, from the Tri-Cities Hispanic Chamber of Commerce, Ophelia Brett's going to give a few words on their perspective on this pandemic.
Good afternoon. Thank you very much for being here. I am with the Tri-City Hispanic Chamber of Commerce. And at work, I often hear folks say that you need to hear information 7 times to really internalize the information. So I think I'm number 3 or 4. And what we know is that the CDC recommends that we social distance and wear masks to slow down COVID-19. So what we ask from folks, from individuals, is to please, if you're not able to social distance, wear a mask so that you can help protect the community and help us move forward to open up our businesses. Thank you very much.
Thank you, Ophelia. Appreciate that very much. Up next, from the Latin Business Association is Frank Valle, who's a small business owner here in downtown Pasco and somebody that's well respected in the community. And certainly his business has been quite affected by COVID-19. So wanted to get him up here to give his perspective, not only from the organizational standpoint, but from his own personal experience. Frank?
Thank you everybody for being here. My name is Frank Valle y soy un miembro de la mesa ejecutiva de la Asociación de Comerciantes Latinos de los Tri-Cities y propietario de uno de ellos. Alcalde Martínez, líderes hispanos y miembros de la comunidad, quiero agradecer a Franklin PUD, Departamento del Condado de Salud de Benton-Franklin y el periódico La Voz por brindarnos la oportunidad de reunirnos este día aquí con el carácter urgente. El coronavirus ha tomado el control de nuestras vidas, pero juntos vamos a salir en la victoria, vamos a seguir adelante en el progreso de esto y abriremos nuestras puertas para ustedes muy pronto. Como miembro de la mesa directiva de la Asociación de Comerciantes Latinos, con más de 40 miembros y representando a muchos comerciantes más de Pasco, estamos comprometidos a obedecer la proclamación del gobernador Jay Inslee. Los propietarios estamos haciendo nuestra parte para ganarle al coronavirus, para poder abrir nuestros negocios pronto. La Asociación de los Comerciantes Latinos estamos organizados con el propósito para avanzar los aspectos económicos, industrial, profesional, cultural, agricultural, educacional y cívico en beneficio del área de Pasco y los Tri-Cities. La LBA logrará este objetivo basándose en el desarrollo de fuerza de trabajo, apoyando la educación y el entrenamiento. La LBA es una organización de comerciantes en la comunidad y todas las áreas de seguir el empleo de los líderes y ponerse máscaras y cubrebocas cuando salgan de compras, al trabajo y cuando estén al público si no pueden mantener la distancia de 6 pies. Juntos vamos a ganarle al coronavirus y veremos pronto el centro de Pasco abierto para que vengan a visitarnos y puedan hacer sus compras. Gracias. I'll try to do it in English for you guys. My name is Frank Valle. I'm an executive board member of the Latin Business Association of Tri-Cities and business owner of a downtown Pasco. Mayor Martinez, Hispanic leaders, and community members, I want to thank Franklin PUD, Benton-Franklin County and Health Department, and La Voz Hispanic newspaper for bringing us together to downtown Pasco for this urgent press conference. COVID-19 has taken control of our lives, but together we are going to beat this. We are going to move forward together, and soon all the business will be open again. As board member of the Latin Business Association and representing 40 or more downtown business members, we are committed to work together as a business owner to obey and respect the stay home, stay healthy proclamation of Governor Jay Inslee. We look forward for beating COVID-19 as a Business Latin Association and business owners to open our doors to serve the public. The Latin Business Association has mission and purpose of advancing and advocating for economic, industrial, cultural, agricultural, educational, and civic welfare for Franklin and Benton counties. The LBA will accomplish the mission by focusing workforce development through its support of education and training. We as business organization in City of Pasco ask you, the Hispanic and Latinos community, to follow the example of the leaders in wearing your mask when going shopping, work, or in the public, Together, we will beat COVID-19 and invite you to come down Pasco to do your shopping sooner than later. Be safe, stay healthy, and see you soon downtown Pasco. Thank you.
Thanks, Frank. Thanks. All right, let's give Frank one more round of applause. Thanks a lot. So we've got a lot of community partners here. Our next guest speaker is Gabriel Portugal, who's been really in every part of the community for years now. He's the president of the Downtown Pasco Association, and if you know Downtown Pasco, they're an integral part of the marketing. And in fact, they just got some CARES Act money that is what appropriated through the city. So they're going to be a huge part of what Frank said, really, getting this city back to where it needs to go, and Gabriel is going to be at the forefront of that. So we really appreciate all his efforts that he does. So let's welcome Gabriel Portugal.
Thank you. Yes, Mike, that's a good point. So right there is our office, is 110. We have the Downtown Pasco Development Authority, and it's also the specialty kitchen in this building right here, the Pasco Farmers Market, which will be remodeled thanks to the city, and some of us are working to get this new place. So, les voy a dar saludos de parte de la autoridad y desarrollo del Centro de Pasco. Nuestra misión es fortalecer y desarrollar el Centro de Pasco como un centro donde los clientes vengan de compras en un ambiente cultural competente. Hoy tenemos la oportunidad de formar parte de un movimiento que ya ha empezado en nuestra ciudad, estado y nación. Vamos a ser parte del movimiento Ponte la Máscara. ¿Por qué me pongo la máscara yo? Quiero decirles que el orgullo puede ser un obstáculo. El orgullo no es tu amigo en esta situación. El orgullo no es amigo del movimiento Ponte la Máscara. Esas son las 3 razones por las que yo me pongo la máscara. Primero, quiero ser humilde. No sé si yo estoy cargando el virus y puedo transmitirlo antes de sentir síntomas a otros. Segundo, quiero ser amable. No sé si la persona a un lado de mí tiene algún familiar sufriendo cáncer o estás cuidando a un adulto anciano. Tercero, por mi comunidad. Quiero que mi comunidad tenga éxito, los comercios estén abiertos y los trabajadores tengan buena salud. Ya lo dijo Mike, yo soy Gabriel Portugal, presidente por ahorita del DPDA. So greetings from the Downtown Pasco Development Authority. The DPDA's mission is to strengthen and develop the Pasco downtown so that customers can come and shop in a family-friendly and culturally competent environment. We now have the opportunity to be part of a movement in our city, state, and our nation. This opportunity is right there in front of us. We get to be part of the Mask Up movement. Mask Up. So why do I wear a mask? Let me share with you that pride can get in the way. Pride is not a friend of Mask Up movement. These are the 3 reasons I wear a mask. I want to be humble. I don't know if I am carrying the virus, and I can transmit before I feel any symptoms. Second, I want to be kind. I don't know if the person next to me has a family member fighting cancer or is taking care of an elder at home. And third, for my community. I want my community to be successful, business keep open, and workers stay healthy. Thank you very much.
Thank you, Gabriel. Really appreciate it. Our final speaker really needs no introduction, Mayor Saul Martinez, the first Latino mayor of the city of Pasco, and he's somebody that every event he's there. You need something, he's always accessible. If there's an issue, he always takes it head on. So he's somebody that's transparent and really has done so much for the city of Pasco, and he's been at the forefront of this fight. So with being so busy, I'm just so appreciative that he could come and really anchor this event and say some words on behalf of the city. Mayor, thank you so much.
Hello, everyone, and thank you for being here today, this afternoon. It is a pleasure for me to sit here or to stand here before you and give this announcement to all of our community. I want to start by saying thank you to Mike Gonzalez and the PUD for their fantastic efforts to try to keep us safe and healthy, and to all the leaders that are here today supporting this cause. We want to make it very clear, this, as Mike mentioned earlier, this is not something it's not to pinpoint any group of people or anything. We're here to simply assist, educate, and inform on this, on issues on this pandemic, and how we can best go about it so that we can try as best we can to get back to some kind of normal. So thank you very much for every one of you for being here today. Muchas gracias por estar aquí en esta tarde. Es un placer para mí estar aquí para servirles en esta capacidad. Es un privilegio de poder hablar con todos los que están aquí, y este anuncio no es nada más para un grupo de personas, pero a todos. Pero en este caso, aquí en la ciudad de Pasco, somos muchos latinos que estamos aquí, y quiero decirles algo, estamos bien orgullosos de ustedes. Ustedes son los que les dan comer y trabajan duro para poder darle a todos, no nomás esta comunidad, pero todo el estado y toda la nación la comida que ellos necesitan. Y por eso los latinos son esenciales y muy importantes para nuestra comunidad. Y por esa razón estamos aquí para tratar de informarles, no para asustarles. Aquí han hablado muchas personas que son de lo mejor que tenemos, para informarnos de que no es para asustarnos, pero simplemente para poder ganar la batalla con esta pandemia, para poder seguir nuestras vidas como era antes y hacerlo lo más normal posible de aquí para adelante. Estas máscaras simplemente es para cuidar a los vecinos, como ha dicho el doctor. Esto no es algo que va a quitar la pandemia. Lo que va a quitar la pandemia es cuidarnos unos de los otros, mantenernos saludables, y no hay para qué estresarnos o mortificarnos. Nada más necesitamos apoyar unos a los otros, los hispanos y a la comunidad. Como un alcalde de este pueblo, yo no les quiero decir que no es el trabajo de ustedes de andar aportándose como una policía para hacer a otros enojar. Simplemente es un gesto de cariño. Por favor, vamos a seguir para adelante, vamos a tratar de llegar a un lugar normal para que se abren nuestras tiendas, y estamos como la mesa, el cónsul de la ciudad, estamos haciendo todo lo posible. Somos 7 del cónsul, y estamos haciendo todo posible para que abran nuestras tiendas y para darle los servicios a todos como antes, como queremos. Y para eso estamos aquí en esta actividad. Quiero animarles, por favor, siguen usando sus máscaras, sean cariñosos unos con el otro, y estamos aquí para servir a la humanidad. Todos somos humanos que necesitamos cuidar uno al otro, y aquí estas personas que han hablado ahora están aquí para informarles. También le estamos pidiendo al gobernador de este estado que nos dé los recursos para poder ayudar a nuestras tiendas, a nuestros negociantes, que yo sé que han pasado unos tiempos muy difíciles, pero créemelo que cada uno de nosotros que estamos de aquí de líderes estamos haciendo lo posible, y el gobernador va a estar aquí en los siguientes 2 días para platicar de esas cosas, y vamos a hacer lo posible para abrir nuestras tiendas. Así que no quiero que se olviden, ustedes son bien vital a nuestra comunidad. y los agradecemos, los apreciamos y necesitamos cuidar uno de los otros para seguir adelante. And with that, I just want to just kind of in English say, I'm very proud of this community. I'm proud of our council. We are vigorously finding ways and being involved in the community to try to bring our businesses back so that we can get the services that we long for and we deserve. And we're just hoping that in the next couple days we can work with our governor so that we can put the parameters in place to safely open up and to explain that we have done everything that we could possibly do and still working at it and doing events like this through the PUD so that we can inform our community how to be safe. Now we have a population out there, we are in the 60 percentile Latinos in this community. These are very vital and important people to our community because they're the essential people out there working in the fields, feeding not only our state but our country and our communities. And we're just encouraging them today to take care of each other, work with each other. We're not asking anybody here to be a police. We're not asking anybody here to get people upset. We're asking here to just care for one another and just care for the person that's next to you and respect all mankind. And we want to give that information out to our community. I want to thank our general manager, Dave Zabel, who's working very hard to help us do the things to progress in this pandemic. Every one of our council members, they are working vigorously and getting involved in the community and trying as hard as they can to do what's right for our community. So with that, let's keep up the Pasco pride. Let's take care of one another, and we just appreciate everybody for showing up today. Mr. Gonzalez, thank you.
Could we give one more round of applause to the mayor? Thank you so much. And for everybody that showed up, Councilwoman Zara Roach is here, so we appreciate you coming as well to show your support, and everybody else. Like the mayor mentioned, you know, our workers are so essential in Franklin County. 70% of our customer base is Hispanic, and that's how really this event got started with the Benton-Franklin Health District. They were looking for ways to reach out to the Hispanic community, and I said, you know what, we'll work with you guys to do anything we can, because we're seeing our customer base really struggle and fight to keep their businesses open, so we want to do everything we can to help. And also, you know, when you look at the essential nature of our workers here in Franklin County and Benton County, you know, 80% of the Hispanic workforce cannot work at home. So when you consider that 80% of those people are either in ag, they're working on the front lines at Walmart or some other place, a grocery store, you know, these are a lot of the factors that go into the reason that in the Hispanic community there's such a spike. So again, we want to do everything that we can to help that process. So with that being said, we're going to open it up for some Q&A for our speakers that are still around. If the media wants to ask any questions, I'm not necessarily a person that, I mean, I can answer the questions if you have any for me in particular, but if you don't, we can break this up if you guys think you got enough. Because you got a lot of sound bites to go through.
I want to talk to Dr. Amy Person, and if Angeles Isa can translate.
Yeah, sure. Dr. Amy Person, and if Angela East can translate for you. We've got some questions for you guys, for you ladies, I should say.
So how do we do this?
Yeah, so just ask a question and so go ahead and shoot away. Yeah, so I would say, why don't you ask the question, she'll answer, and then we'll have her translate. So you can, well, I guess you got a social distance.
So, Dr. Amy Person, has Benton and Franklin reached the peak yet?
No, I don't think Benton and Franklin counties have reached their peak yet. We're still seeing our case numbers increasing.
La pregunta era que si el condado de Benton-Franklin ha visto los máximos de los casos, y la respuesta a eso es no. Aún no creemos que hemos llegado a lo máximo de lo que son los casos.
Do we we have enough data to know if and when we will hit our peak?
We have data, but it's really more than just data. We could potentially be at our peak if everyone does what they need to do. If they wear their mask, if they remain physically distanced, if they're staying home when they're sick. So if we stop transmitting infection to one another, then our rates will drop, and we will have been at the peak. So it's not about data, it's about the actions we all take.
La pregunta era que si tenemos suficientes datos para ver si hemos llegado a lo máximo. La respuesta es, no se trata de los datos que tengamos, sino de las acciones que podamos tomar para que podamos nosotros prevenir esta pandemia. Entonces necesitamos hacer lo que es necesario, usar las máscaras, protegernos y proteger a la comunidad. Y así podemos mitigar esta pandemia.
With 4th of July approaching, do you think we're going to see another spike in COVID cases here in Benton County?
With 4th of July approaching, that is a concern because, you know, as with other holidays like Father's Day, Mother's Day, Memorial Day, after all of those, we did see an increase in cases. That's part of why we're out here really trying to push that message, because we don't have to see a spike after 4th of July if people really limit their gatherings, do the things they need to do.
La pregunta era que si con el 4 de julio hay preocupación de que los casos incrementen y sí, la respuesta es que con el 4 de julio podría ser que los casos podrían incrementar como lo hemos visto en otros días festivos como el Día de las Madres. Entonces es importante que cada quien haga de su parte para poder prevenir esa transmisión y para así disminuir los casos que estamos viendo.
We actually did conduct a survey. We released those results end of last week, and I believe it was somewhere between 55 and 60% of persons in the Benton and Franklin counties were wearing masks. So that actually is not bad, but we really need to be more like 80 to 90% in order to really stop the spread of COVID-19.
La pregunta era que si el condado de Yakima hizo una encuesta sobre las personas que usan la máscara o el cubrebocas y que si nosotros aquí en el condado también hicimos una. La respuesta es sí, se hizo una encuesta y los resultados los pusimos la semana pasada, los pueden encontrar en nuestra página de web y el resultado fue de un 57 a un 60% de personas que aquí en el Tri-Cities estaban usando una mascarilla o un cubrebocas. La meta es de que ese porcentaje llegue a un 80 a un 90% de personas que usen su mascarilla y es por eso que estamos haciendo en tratar de llegar a la comunidad para que la comunidad tome conciencia de que necesitamos todos usar la mascarilla.
So we've said in the past the Latino community has been hit the hardest in both Benton and Franklin. What is it about the Latino community specifically, or if you can specify, why are they being hit the hardest with COVID cases?
I don't know that we know it's any single factor. We know that this is a community that many of the workers don't have the luxury of working from home, so they have to be out. They couldn't stay home, stay healthy. They had to be working. Sometimes they had to be working in conditions where they could not be physically distanced. So I think there are many things that contribute to that, and that's why it's important. There should be no single community that has to be hardest hit by this. This is something we should be able to take care of everyone here.
Doctor, thank you for coming out. I have a question for you. We're going to wrap. David, you're going to be the final question on the final there because she's got a head to her,
Okay, anyway.
That's the last question.
La pregunta era que si, ¿por qué la comunidad latina es una de las comunidades que se ha afectado más fuerte? Y la respuesta es que no creo que tengamos una respuesta concreta. No se sabe cuál es el factor por el cual la comunidad latina está siendo afectada más fuerte, pero sí se sabe que los latinos o la comunidad latina no tiene el lujo de trabajar desde la casa, entonces tiene que salir a su trabajo y desafortunadamente puede que por el tipo de trabajo que a veces la comunidad latina tenemos, estamos más expuestos y por eso es que no se puede tal vez en ese aspecto apuntar a un solo factor de lo cuál es la razón por la que se está infectando más la comunidad latina.
Doctor, in the past weeks you reported to the media that 48% of those confirmed positive were Latinos. What is the number today that are confirmed positive for the coronavirus?
I'm going to say I'm not sure I have that off the top of... 50%. Sorry. I'm being informed by those who know better than myself. 50%.
Thank you. The second question is with the governor coming to town, and I'm sure he's going to come to talk to you and find out what's your recommendation with Benton and Franklin County asking to open up to go to the second phase. What would be your recommendation today to the governor when he arrives tomorrow?
You know, my recommendation would be the same as it was before when I originally talked to the Board of Health about us submitting the application. I do know that our disease rates are high, but I also know our community is suffering in many ways, economically, emotionally, socially. So I believe there is a way that we can do what needs to be done to help fight this infection and help our communities move forward. And we need the support of everyone. We need the support of our leaders, and we need the support of everyone on the ground as well.
Doctor, thank you so much. Does anybody else have any questions for the mayor? He is still here, or any of the leaders that were out here? Are you guys good? No, Dr. Garcia had to head to another event. Okay, well, that'll wrap it up. Thanks again. We really appreciate everybody coming, especially the media and all the folks in the community. So, you know, let's do our part and get these businesses back open. Thank you, guys.